Hello, everyone, and thank you for joining today's webinar, Supporting Your Child with OCD and Anxiety. I'm Georgia Weston, and I am the Executive Director of CHIP, Creative Healing for Youth in Pain. We're a nonprofit providing educational resources, exposure to creative healing experiences, and social support online. And today we'll be discussing how problematic anxiety is the most common mental health issue in children, yet it often goes unrecognized at school and at the home. We'll be presenting useful tips for recognizing anxiety and OCD in children and describing effective parenting strategies for helping them manage these symptoms. We have a great discussion planned with your live Q&A questions. We would like to ask that everyone please keep yourselves muted and your cameras off so we can enjoy without distractions. And you are also able to type your questions into the Zoom chat throughout the discussion for our speakers to address. And now I am pleased to introduce CHIP's board member, Dana Pacholski, who will be moderating our conversation with our guest, Dr. John Piacentini. Dana also serves on the board of the UCLA Resnick Neuropsychiatric Hospital, is co-chair of the Regenerative Medicine Institute campaign for Cedars-Sinai, the vice chair of Cedars-Sinai's Innovation Center project for the Board of Governors, and is a board member for the Caton Children's Museum. Dr. Piacentini is a professor of psychiatry and director of the UCLA Child OCD, Anxiety, and Tic Disorders program, and the Center for Child Anxiety, Resilience, Education, and Support, which stands for CARES. As a board-certified clinical child and adolescent psychologist, his work focuses on the development and dissemination of evidence-based treatments for youth with OCD, anxiety, tic, and related disorders. He has published over 300 papers, including 7 books, and his research has been funded by the National Institutes of Health and other leading mental health foundations and organizations. Thank you so much for being here today. Now I will hand it over to Dana and Dr. Piacentini to get our discussion started.
Thank you, Georgia. Welcome, everybody. And thank you, Dr. Piacentini, for all your expertise and sharing some time with us today. It's been a very difficult time for a lot of people as their kids have gone to college, and we're coming out of the pandemic and we're fully ramped up. So we really appreciate your time.
Yeah, it's my pleasure.
So I wanted to start really with talking about anxiety, and we can work out to OCD and its interrelationship with that. But I think if you could take a few minutes to discuss the chicken and the egg concept with anxiety and pain and the body's signaling, right? As we get outside stimulation, is it our stomach that's telling us that something's not right, or is it our brain that's telling us something that we need to worry about? If you could give us a little bit of background on how that works.
Sure, and that's it is a bit of a chicken and the egg. I think it's helpful to start a little more kind of basically as you're suggesting about what anxiety looks like, maybe how it works and how that relates to some of the physical sensations and pain, because certainly the physical symptoms of anxiety are often most prominent. When we think of anxiety, we think of anxiety expressing itself in three channels, 3 ways. And the first actually is the physiologic channel, or the physical symptoms of anxiety. So we know that headaches and stomach aches are very common symptoms in kids with anxiety, as well as other physical complaints as well. The second channel is the cognitive, is how we interpret these physical signs and symptoms from our body, how we interpret other things in the world that we might think are dangerous. And then the third channel is behavioral. So what do we do when we have these physical sensations or feelings, when we have these thoughts that we're saying that something is wrong because of these sensations? And in anxiety, typically it's avoidance. So you avoid things that are scary to you. You run away from danger. You seek reassurance from a parent or somebody else. And this may sound somewhat familiar. Really, it's the fight or flight system. It's the evolutionary system that keeps us safe, that alerts us to dangers. So, in the way back when, in the forest, animals, when they hear a twig break, that triggers this fight or flight. They think that there's some kind of a danger, and they fight, they flight, or they freeze. And it really is triggered by these physical sensations. So if we're faced with danger, we need to mobilize our bodies to escape. And we have a release of all sorts of different hormones. Our muscles may tighten up, our breathing will increase, our heartbeat races. These are all the symptoms of anxiety, all the symptoms of fear. And they mobilize us to keep us safe or to allow us to escape. But anxiety, people with anxiety, kids and adults, they tend to fight, the fight or flight reaction tends to trigger in situations where there is no danger. So when you ask an anxious child, you know, I'm afraid of this, and the whole cascade of symptoms occurs, you know, we may look around and say, well, there's nothing really dangerous here. People with anxiety tend to interpret the world as more dangerous than people that don't have anxiety. And that's what we see here. And in treatment, these are the things we want to target. So, you know, the relationship to pain, and I'm not a pain expert. I don't work in that area. But my sense from working with some kids that we see with pain is that it may be a bit similar. You know, the pain symptoms that kids with chronic pain feel may be somewhat similar to the physical symptoms that individuals with anxiety feel. And it's the same, it's that interpretation, the cognitive interpretation, something is wrong, something is bad, that actually increases our physiologic arousal because it makes us more nervous, which can increase the pain, which can increase our fear, and then that leads to the behavioral symptoms. The other thing to think about with this is that if I'm an anxious person, I see the world as more dangerous. And that doesn't mean only the external world, it also means the internal world. So if I'm afraid that there are bad things in the world or scary things, I'm going to be really vigilant and alert. But I'm also, kids with anxiety and people with anxiety are more alert to what's going on inside their bodies. They're more it's more of an interoceptive alertness or focus. So when they feel a blip or a bleep or a funny twinge or a pain in their body, a lot of people don't pay attention to that. It's just whatever it is. But somebody that's anxious is really going to focus on that. That's no different than maybe somebody coming at you with the gun. I can have threats from the outside world and threats from inside my body. So these little physiologic things that happen in our bodies, or pain, for example, maybe real pain or muscle tightness or the heart skipping a beat. These are the kind of things most people ignore or say it's okay. Somebody with anxiety is going to focus on that, as this means that there's trouble or danger. And they're going to start cycling up. They're physiologically, their thoughts are going to spiral up, and that's going to increase these physical sensations and maybe leading to more of a pain approach.
Well, that's interesting because it makes me think about how parents look at their child and they said, but everything was fine. And now suddenly everything has just, the whole house of cards has come down. And then everybody has this overreaction to a system that's already overreacting. And so that leads to the parenting piece of when you see your child entering into an anxious moment or a overstimulated bodily response to the world at that point, you know, i.e. anxiety, what can they do?
Exactly, and that's what we see. So involving parents in the treatment of anxiety is crucial. And I like to think that if I had 30 minutes to work with an anxious child, I probably would spend most of that time with the parents, because it really is the parent reaction here. I don't know if you can hear noise. I'm sorry, I left my window open and there's a garbage truck right behind me. I can hear it. If you can hear it, I can close
It's
the
not
window.
bad. No, it's not bad.
Okay, I'll keep going through.
Speaking of external stimulation and
Right.
response,
So,
right?
so my stomach is hurting. I'm getting a headache. I'm starting to worry a little bit. I want to run away or close the window, but I'm going to fight through it.
And as a parent, I want to ask you, are you okay? What can I do to help you? What should we do? Does your stomach hurt?
Right, exactly.
It was a perfect example.
And if you ask your kid, are you okay? Does your stomach hurt? You know, it's like, well, it does now.
Right? And they didn't know it didn't a minute ago.
We want to teach parents to reinforce or provide attention to the child, you know, the brave behaviors, the non-anxious behaviors. But as parents, this is what I do. My job is I'm an anxiety, you know, therapist. If my kids experience pains or thoughts or worries, we are evolutionarily wired to respond to our kids' distress with trying to fix it or expressing concern. And that's parenting. I mean, we need to do that to some degree, but too much of that reinforces the symptoms. Oh, great, now mom is nervous. Oh, great, now dad is asking me questions. He must be worried too. That serves to ratchet up the anxiety even more, which makes the parent more anxious, which makes the kid more anxious. And again, after, you know, repeated events of this, it starts getting burned in, and it can really lead to greater problems with anxiety.
So when we see a child that starts this process of exhibiting new expressions of their body not being in total balance, i.e., a stomach ache, a headache, before it gets to the outward, I have anxiety, or somebody else labeling them as having anxiety, what can a parent do so that they don't walk in it? Because as parents, we want to fix.
Mhm.
And it sounds like this isn't when we should be walking in with our toolkit saying, let me fix this.
Yeah. Well, I mean, as a parent, the first thing we need to do is to make the decision, is there a real threat here? Is something wrong or is it not wrong? The child doesn't want to go to school. Is that because they're nervous, that they might have to talk in front of class or give a book report, or can't find somebody to have lunch with, or is there a real threat? And 99.9% of the time, there's no real threat. So what we need to do is not focus on the anxiety or the worries as much, but rather provide support and confidence in the kids, or distract them, help them do something else, for example. Well, so it's important that we don't get caught up in the cycle. And one of the big things that we talk about in working with anxious kids and families is accommodation. So accommodation is parents responding to the anxiety in a way that might reinforce or make the anxiety worse. For example, letting a child stay home from school, or saying you don't need to go to the play date, or speaking for the child in any kinds of situations because the child might be too nervous. And that doesn't allow the kids the opportunities to go out and face their fears, face their anxiety, learn how to manage, learn how to function in situations where they might be feeling some, different kinds of anxious symptoms, or maybe even some pain of different sorts. Because we all have to work through things. Nobody's ever in peak shape, probably mentally or physically, but we get through and we learn how to cope. So when we work with parents, it's really important to not accommodate or give in to the anxiety. I mean, within reason. If the kid's having a panic attack or really sobbing, you're not going to throw them on the bus. But we want to, before we get to that point, we want to really encourage kids and give them, we have some skills we can teach them, give them the confidence that I know it's a little bit scary for you, but you're going to be great. You're going to do this. And that's hard for parents to do sometimes. And as sooner we can get this going before the symptoms get worse, the better, because over time, if the parents keep letting the child stay home from school, the kids learn that it's better to stay home than go to school. And it also reinforces this fear. Well, if mom is letting me stay home or dad is letting me stay home, they must think it's also dangerous. And then, if days or weeks or months go by and all of a sudden the child needs to go to school, forget it. It's going to be really difficult.
I think talking about how kids perceive us as parents and what we think is fearful, I think that was a really important point, because as a parent, we think, we're just going to let them stay home. But you're right. We're reinforcing that was so scary that even we agree you should stay home.
Yeah, absolutely. And then the other thing that happens with that is, the typical scenario is that the child wants to stay home and the parent says, no, you need to go to school. And the child may cry. The parent says, you need to go to school. And the child may tantrum, and the parent gets more angry and says, you need to go to school, and gets angry. And then there's this cycle of escalation where every time the child responds with more negativity or anger, the parent does too. And it builds up. So it really gets into this fight. And we've all been there with our kids. And unfortunately, the first one that blinks is the one that loses. So if the parent gives in at the height of the argument, the child learns, I just need to cry enough and be negative and tantrumy enough that I can wear down my parents and I'm going to stay home. So the next time that happens, the child knows, I just need to escalate and escalate and escalate if I want to stay home. And if the parent argues and escalates and, gets really, really comes on really strong, by grounding or yelling or screaming or pulling the covers off or whatever it is, the parent learns, I need to really kind of get to that limit before my child is going to give in. So they're learning these habits that really can be negative. So that's the idea of trying not to escalate, of staying calm. Parents need to stay calm, and they need to be firm, and they need to create a consistent message, even when the child escalates. It's really important for the parent not to escalate as well, but to stay firm, because over time, these patterns really can develop. into pretty negative interactions.
And it sounds like, the concept that we use at Creative Healing for Youth in Pain, CHIP, is that we get these kids that get so dysregulated, whether the anxiety and the depression starts or the pain created the anxiety. It doesn't really matter. The
Mhm.
end result is they stop performing, stop wanting to go to school. And what we do is we really just retrain the brain. And if people ask me, what do we do? The most important thing we do is we get the child to do something different than what they were doing. And it reminds me of what you're saying right now in this parent, I don't want to do it and you need to do it. As parents, we should probably just remember to change the subject, change the dialogue right there. We don't have to be engaging and fighting this at the moment. We can say, oh my God, wait, I forgot something and I'll come back and then re-engage, right? We could start over.
Exactly. You walk out, you have 5 minutes to get ready and you walk out. I have 4 kids. I don't think I've ever won a battle with them. Kids are very good at winning the battle, right? They're smart. They're motivated. It's hard, and it's so easy to fall into this trap of escalation. So we need to maintain calm and disengage. Do not engage in these cycles, because over time these can get pretty severe, and the kids do end up staying home. They become more incapacitated over time, and then it's much harder to get kids back to health.
And as parents, we feel that once they start this dialogue or we start the dialogue, we have to stay until the end. And I think your concept of whoever blinks first, and I think it gives permission to parents to say, wow, I'm acknowledging my child as being dysregulated. I'm acknowledging that they have anxiety over something. I'm not going to fix this in this conversation. Let me change the dialogue, but still acknowledge them and maybe help the anxiety cool off, the fear and fight or flight.
That's exactly right. And providing parents with skills that they can use to manage or maintain their own anxiety or anger or whatever emotion that they might be experiencing.
Well, that leads me to a question that a few of my friends have asked with college students at the moment. So their seemingly well-balanced child went off to college. They were doing great. And about 2 weeks in, they're showing signs of anxiety. And it's perfect what we're talking about, but we're as 18-year-olds. What can a parent do? What do parents do when they see their kids starting to do this at that level where they're not in the home? How can we help them acknowledge that, wow, your body is registering something as not being in balance?
Yeah, that's a really good question. A lot of it starts early, by giving the kids, as they get older and they get closer, more autonomy, teaching them more responsibility. When kids are at home, oftentimes the parents, even for, high school seniors, a lot of times, they wake them up, they make sure they get out of bed, they pack their lunch. We like having our kids, and the kids, even the well-adjusted kids, may go to school and they just don't have the experience of being able to take care of themselves, managing their time, trying to get to bed at the right time, getting up at the right time, studying, doing the things that they need to do, even with meals. So really, we want to start as early as we can, giving kids more responsibility and autonomy, and for taking care of a lot of the things that they need to do. But when kids do go off to college, sometimes it can be homesickness. It can just be it's just a foreign environment and they miss being at home. Sometimes they really don't have the skills. They're not confident in their ability to manage all of the different things that they need to do, including self-care. But what it is really important to do is to, express confidence in the kids. Certainly coach them. Coaching is okay, but not doing it for them. We don't want to do it for them. And, just, giving kids the sense that, it's a transition. It's going to be difficult, but stick with it and get through it. Our instinct oftentimes is to rescue our kids. And as soon as they face adversity, is to go rescue them, pull them back, do things for them. And sometimes kids do need to struggle. I mean, that's part of life, is struggling a bit until they can find their footing. And once they do and they develop that mastery, it's a wonderful thing. again, we need to monitor, and with our third eye, as we're talking to them about things and that they can do it enough. We do need to keep our eyes out for real signs of that something might be amiss. So, we don't want to ignore our kids' concerns or our kids' struggles, but we need to evaluate. And if we think that it's kind of a growing pain kind of a thing, then we want to really give them the skills they can to be able to get through it without us needing to come in for the rescue, because that really can set kids back, and it teaches them that they don't have the ability to manage on their own. And we want to avoid that.
Well, that tees me up for my next question, which is, what are the warning signs that parents can be looking out for, with their kindergartners on up? What do we look for in the bodily response? What do we look for from a psychological response, that we can be ahead of this as parents?
Well, since this is a group that you all work with kids with pain syndromes, I mean, stomach aches and headaches are kind of the number 1 and 2 early signs of anxiety, when kids complain that they don't feel well, without kind of a reason. They didn't eat, if they ate bad food or something, that would be one thing, but that they have stomach aches or headaches. Or that they want to avoid things. I don't want to go to school. I don't want to go to my friend's house. Does grandma really have to come over? I don't want to take this test in school. I don't want the play date, whatever it might be. So if they start avoiding situations that could potentially be anxiety provoking, like being away from the parent. So separation anxiety is very common in kids, that they are afraid that if they separate from their parents, something bad is going to happen to them, or something bad is going to happen to the parent, and they're never going to see each other again. So these are the kids that want to stay home from school, that don't want to go out, that if they tag along with mom everywhere and really don't want to be in a room by themselves, that would be something. Other kids may not want to go to school or do things because they have social anxiety or social fears. They worry about a negative evaluation. Social anxiety is really fear of negative evaluation, that people are going to think I'm dumb or stupid, or that I'm going to do something really humiliating. So really, a lot of anxiety we see as avoidance, of wanting to do things or be away from the parent. And the kind of the nature of the avoidance can relate to the specific type of anxiety. So kids that don't want to go play on their soccer team or do their music lessons or whatever. And then seeking reassurance is another very common symptom. Is this going to be okay? Am I okay? Are you going somewhere? Do I need to do this? What if kids laugh at me? These are normal questions that kids can ask. But if it becomes a pattern, and it is associated with this avoidance, those are the things that we really start thinking about as potential signs of problematic anxiety. And then crying, tantruming, things like that.
It makes me feel that when our children come and they say, I'm really upset about this, and as parents, we want to ask more questions, but we're really not always registering that our child just said, I'm having a fight or flight response to this. So as parents, if we then jump in, excuse me, and say, well, why did that bother you? Tell me about it.
Right.
Are we pouring salt on that wound? Are we helping that fight or flight exacerbate?
Right. That's a good point. Yeah, there are 2 responses. It's like, what? Get
Tell
over
us
it.
more.
Or where is that kid, man? Who did what to you? I'm calling the school right now. Neither of which are appropriate. We want to listen to the kids. We want to validate the kids. Sounds like that was really hard for you. Oh, okay. So what else happened? Okay. Yeah. And then how did that make you feel? That sounds like it was difficult. So we want to validate the kids. We can't ignore them. You can't just say, oh, brush it off and grow up, because that's not helping. But understand what's going on, normalize it. A lot of kids feel this way, and oftentimes if we can use our own experiences, that can be helpful. Yeah, I remember when I started 2nd grade, I was kind of scared too. My mom actually had to come and get me the first day. I was so scared, but then I went back, and after a few days I got comfortable and I really liked it. I think the same thing will happen with you. So really listen to our kids, make sure that they know they're being heard, that they're being understood, but we are not accommodating. We are not fighting their fights. We are not letting them stay home.
Well, and also we're not letting ourselves be triggered by what happened to us in 2nd grade. right?
Yes.
We're not responding, so often we don't realize we're responding with our prior history in our second grade as we are trying to help our second grader get through their trauma.
Oh, absolutely. So it's great to say I felt the same way and I got through it, and look at me. I'm a mom now. I'm your mom. I'm your dad, I did okay, right? You can too.
And this stomach ache feels bad right now.
Mhm.
But it hurts for right now. What else can we say to that? When our child says, my stomach hurts and I have a headache and no one knows and no one sees me and nobody understands me. What can the parents say at that point?
Well, again, you do want to make sure that they're not sick, that it is anxiety or that it is something else. But you can just say, yeah, I mean, that happens sometimes when we're feeling nervous or anxious or upset, but let's go do something and maybe it'll go away. And so that would be maybe a distraction in some sense. So, if they need to go to school, well, I think it'll be okay. I think if you go to school, and you're going to be busy doing other things, and if you're engaged in doing something that you like, you'll probably forget about it. Or headaches, yeah, headaches aren't very fun to have, but they usually don't last that long. Or something along those lines. If they're at home, well, let's let's do a breathing exercise. We do a lot of breathing exercises with kids. Or let's do like some visualization. Let's imagine which a nice place or a happy place that you like to go. Let's engage in an activity, something like that, to get their mind off it. But if the kids just sit and stew, or if parent shows a lot of concern, oh no, what's wrong? I better call the doctor. I mean, that's going to set off that fight or flight, and the kid, oh my God, maybe I'm really sick. And that's probably going to worsen it. And then the parent gets more concerned. If the child expresses worsening symptoms, the parent gets more anxious, which again is more fuel for the fire.
And after seeing doctors with no diagnosis, you get more anxiety.
Yes. Uh-huh.
There's a really good question that's coming up, and it goes back to, again, chicken and egg. Can the anxiety be from a physiological dysregulation in the brain chemistry, or is it usually a fight or flight response to nature nurture?
Right. Well, it's both. Fight or flight actually is a physiologic response. It's a hardwired response in our brain. We don't control fight or flight. It's automatic. If we had to stop and think, wait a minute, is this dangerous? Should I run, or what should I? By that time, the saber-toothed tigers already had us for dinner. So this is all hardwired. It's automatic. It's kind of instantaneous. When the brain registers danger of any kind, bang, it goes off. Now, for most of us, the bar is set pretty high, for fight or flight to go off. But for people with anxiety, it's called negative threat bias. So they see the world as more dangerous. So they tend to see innocuous things as dangerous. They're wired. It's biological. They are wired in their brains to respond to anxiety more commonly. And one of the analogies that we use with kids that I think is pretty helpful with this regard is thinking about car alarms. We've all heard car alarms go off all the time, maybe less so than they used to, 10 years ago. But if you ask a child, how many times have you heard a car alarm go off? All the time. How many times have you actually seen a car being stolen when the car alarm is ringing? Never. Our anxiety is like that. Our anxiety is like the car alarm. It goes off all the time when the car isn't being stolen. So our anxiety alarm goes off all the time, telling us something dangerous is out there, even when there's nothing dangerous. And that's an analogy that I think is useful, or something similar. We can do fire alarms as well, like in school when the fire bell goes off. How often is there actually a fire? Never, because the fire alarm goes off by mistake, or there's a drill, or whatever it is. So the first question we need to ask when we feel anxious, is there something really dangerous here, or is it just my anxiety alarm going off? And that's one way that we can help kids take that first step to not automatically react. So it really is kind of triggered. The environment triggers the brain, which sets off the anxiety. But to get back to your question, sometimes physical symptoms can trigger the anxiety. If I feel all of a sudden a pang in my stomach, or I notice I'm a little short of breath. And that might not even be from fight or flight. It could be from what I had for lunch. It could be because I was hurrying to get somewhere. Sometimes we just get a headache or a little, pulse or a rapid heartbeat for no reasons. And again, if I'm more attuned to what's going on in my body, that might trigger my alarm that something's wrong physically. And that could trigger the anxiety. Then that would trigger the anxious thoughts and the anxious behaviors.
Well, in the world we have today and we live in, it's really hard as a parent to say, okay, when you go to this party, don't drink out of an open cup. So it leads me into the next thing. How do we as parents help our kids see that there's some things out there to be fearful and parent them without triggering this very cyclical cycle in our children? Because we have a lot of teenagers that right now that have been at home for 2 years, are back out there. And as parents, we need to give them information. And now that we know that we don't want to trigger their autonomic nervous system in this fight or flight, how do we parent that?
It's been a real nightmare for everyone, but especially for anxious kids and parents of anxious kids and anxious adults. COVID has and being out of school has really wreaked havoc for a lot of anxious kids. It's important, and a lot of it is education. And there are certain things, we wouldn't want our child running out and playing in the freeway in the middle of the night. We do need a little bit of anxiety. Anxiety, again, it serves this evolutionary purpose of keeping us from doing things that might be really dangerous. So I think it's up to us as parents to really kind of draw the line and help kids, distinguish things that are dangerous or potentially dangerous from things that aren't. And that's why when our kids ask us questions about these things, like I don't want to drink out of that cup. I don't want to drink that. I don't want to go there, to say, why? What's going on? Can you tell me more about that? And if they say, well, our teacher said we're not supposed to drink anything out of cups because of COVID, then as a parent, we can explain to them, you're right, in this situation, this is a different situation. This isn't, this would be safe to do, and here's why. We don't want to, again, accommodate the kids, in some ways. We don't we don't want to make stories up. We want to be clear about them, and that we can distinguish these two things. We don't want to really let kids off the hook either if they need to do something and they're afraid because this might be contaminated. In COVID, if we think it's contaminated, we can clean it. And what we usually tell parents is, we follow CDC guidelines. So like kids with OCD and hand washing, in our clinic, we contaminate kids. The therapist and child may go into the bathroom and they may touch things and not wash their hands, like the sink or the doorknobs, because that's part of the OCD treatment. We need to be more careful now with COVID. We can't do a lot of those things. But I think it's up to parents or teachers or adults to kind of explain to kids when they're in a situation whether this is something that they should avoid or this is something that they don't need to avoid.
I think that parents are feeling very uneasy about, how do I push my child into these situations? How do I parent them through that? And although we just covered that, I think we may need to talk about it in terms of teenagers, because the same thing applies, right? As a parent, we have to walk a fine line between seeing them, acknowledging them, helping them feel that we're not feeling uneasy, and then parenting them to help push them without making them feel pushed into something they don't want to do. And I think for teenagers would be a really good example if you could help us through that.
It's hard because anxious kids grow up into anxious parents, and anxious parents have anxious kids. So a lot of kids with anxiety, there's probably a higher chance if you have an anxious child that there's some anxiety in other family members. Even beyond that, everybody's anxious right now to some degree. I think it's important to be honest, especially with teens, depending on the age of the teen and the maturity. If the child is expressing some anxieties or some concerns, again, we want to listen. We don't want to react, overreact. We want to listen. We want to help the kids understand. Again, a little bit of self-disclosure, if appropriate self-disclosure, I think can be helpful. We want to normalize the fears. You're not the only person feeling this way. A lot of people are feeling this way. But it's important not to let these feelings or fears hold you back. With teens, especially older teens, I really like to talk a lot about kind of what are your goals, what are your values, what's important to you. College is really important to you. We've talked about this, and it can be scary. It definitely can be scary. It's a big change. It's a big switch. Your life is going to be different when you go off to college, or take studying for the SAT or whatever. But this is really something that you've wanted to do, or this is an important step for you. So we will be here with you. We'll be here to help you. To be honest, I get a little anxious too. I remember when I did this, and my parents were anxious, and I was anxious too. But we worked together. We're going to work together to get through it. And I just think that's just being calm, being supportive, being there, listening to the child can be extremely helpful. There are also techniques, that kids and parents can do together on our CARES website. We have a lot of handouts and videos about exercises that parents can do, or kids, anybody can do to manage anxiety, breathing exercises, thought exercises, other kinds of things that are very simple. And I think it's really helpful for parents to learn a lot of these techniques. I'm sure you probably have a lot of these different kinds of techniques and strategies as well, through CHIP. But I just think being with your kid and being honest and listening, it can be really important in that regard.
I know when I was driving my children to school, I used to take the long way. Sometimes the long way is more torture for the parent, but better for the children. It just depends. Sometimes we want to get the fastest way.
Yeah, it gives you time for the child to settle. Transitions can be difficult for a lot of people, and especially for anxious kids. So see, that's a great strategy, spending a little more time together, slowing things down a little bit, but not allowing full avoidance. But tell you what, let's do this first, or on the way to where we're going, why don't we stop and we can get like you a snack or something like that. Rewards are also very important, for kids. So again, we don't bribe. We never bribe in the middle of a tantrum. Okay, if you go to school, I'll buy you a dog. We don't do that in the morning with a tantrum. Once the child is calmed down, we'll say, I know this is hard for you. So after school, after I pick you up, why don't we can get ice cream? Or would you like to go shopping? Or you get to pick what you want for dinner tonight? Or, rewards that are commensurate with the difficulty of the task. And I think that can be really helpful for kids too.
It made me realize that parenting teenagers right now must be really hard because it's a digital world. And so they're getting this extra stimulation. They're going behind doors, and parents are having this limited time where they have to catch their child. And we were doing a lecture on parenting during the pandemic. We realized that parents were waiting for their children to emerge from their room, and they were pouncing on them because they had a list of questions they needed to get done.
Yeah.
And we had to retrain parents to say, okay, hi, do you want to have something to eat? Not, how did that go? Can you go to the doctor this time? What do we need to do?
Yeah, exactly. And the kids, and actually in some of the other talks I do, I actually have some slides and on this. The anxious parent of the anxious kid, or the parent of an anxious kid, when the child comes home, how'd it go? Was anybody mean to you? How did your book report? Did people laugh? And that just blows the kid's head up. So we do not want to ask leading questions. Exactly what you're saying. We don't want to ask leading questions. It's like, how was school? You can ask open-ended questions and neutral questions. I'll bet you did great. If the child says it was hard, yeah, but you were able to do it. You don't focus on it was hard. Why was it hard? You say, yeah, I know. I it sounds like it was hard, but you know what? You did it. Focus on the positives. Focus on the accomplishments, because that's going to be really important.
And what about the child who says, I did it, but now I have a stomach ache?
That's okay. Let's get something to eat. Let's get a snack. Would you like to go for a walk? Why don't you go play with the dog for a while? He misses you.
So again, it's the seeing and rerouting. And it's really what I'm really feeling is, if anybody gets a takeaway from this lecture, is empowering parents to not feel they have to answer directly, but to see it, tell the child, oh, wow, I feel that. And then try to ask something that moves it a little bit, but not just like, oh, the sky is blue, but redirecting.
Validate and redirect.
Yeah,
exactly right. Because it's like, in the classroom, the kids that are making all the noise are the ones that get the teacher's attention. The anxious kids don't get the attention so much. And just as a little side note, about 70, I think the statistics are about 70 to 80% of kids with ADHD get treatment. About 20 to 30% of kids with anxiety get treatment, because anxious kids they're not seen so much. And when we're working, with anxious kids, when they come home, we feel like we need to listen to everything that's going on with the child, every possible anxiety and fear, because that's our own fears. We want to make sure that nothing bad happened, and we feel we need to protect our kids, but we don't need to. It's okay just to validate, and we don't need to hear every detail that happened with these kids. It's okay to just let them do what they're doing.
But I think it's an awareness from the parents to say, am I being triggered?
Mm-hmm.
Or is this just my child's trigger?
Yeah, good point. And again, we need to manage our own anxiety. Even if we don't have we don't have an anxiety disorder as parents, we still worry about our kids. It's hardwired, right? We exist to protect our kids. It's from an evolutionary perspective. We're irrelevant other than seeing that our kids grow up and do things. So oftentimes we become very involved and very over-involved and very anxious about the kids. We want to make them feel good. We don't want our kids' feet touching the ground sometime. We just want to protect them, cocoon them. Any negative thought, any negative feeling, we want to erase it right away. But that's not the way that it works, because we want our kids to be resilient. We want our kids to learn how to manage themselves. And starting at a very early age, you can do this. So when our kids go off to college, they're not lost, because they have no idea how to work through a difficult situation, or through feeling anxious or unsure or about something that they need to do.
Well, I really think this parenting piece is an enormous piece, but I also want to talk a little bit about what happens to the child that already has gotten enough of the brain saying, fight or flight. I'm sending all the signals to the body to be ready for danger. I'm heightened, I'm alert, I'm looking for everything. My stomach hurts, my head might hurt on occasion. I have no other diagnosis. I don't know if we should jump into the medicine side of this, but what are the treatments? What should parents look towards at that point when they realize, wow, the dysregulation is more than this, just validate and redirect?
Well, actually, the first line treatment is cognitive behavior therapy. It's a exposure-based cognitive behavior therapy, and cognitive is the thoughts, behavior is the behavior, and the physical symptoms are the triggers. So in this treatment, and many of you may be familiar with CBT for anxiety, is we want to help the kids identify the triggers to their anxiety. We want to identify the physical symptoms that they feel, the physiologic symptoms. I get stomach aches, I get headaches, I get shortness of breath, I feel panicky. And then there are a number of techniques that we treat them to help them manage these physical symptoms, like breathing exercises, mindfulness, guided imagery. Again, you all may be familiar with some of these techniques to help them manage the physical feelings. Then we address the cognition. So, anxiety is triggered by the fear that something bad is going to happen. What is the exact fear? I'm afraid that if I go to school, something bad's going to happen to mommy, or I'm going to get kidnapped. Parents getting in car accidents on the way to pick the kids up from school is a big thing for separation anxious kids. And if a child with separation anxiety is at school and mom is 5 minutes late to pick them up, and we live in LA, so mom is usually, I know we were always like 5 or 10 minutes late picking our kids up. They start worrying that something bad has happened. So we want to identify what these thoughts are and help the kids learn how to manage these thoughts or reframe these thoughts. It's probably likely that mom's just stuck in traffic. Or if kids were giggling while I was giving my book report, I wanted to run out of the school and hop on a train and never come back here. I'm so humiliated. They weren't even looking at you. They were just looking at each other and playing a game or something like that. And then we identify these behaviors, which are, avoidance, crying, whatever it might be. The key ingredient is behavioral exposure. And what behavioral exposure is we make a hierarchy of the things that the child is afraid of. And we start low and we actually expose the kids to these situations. So if a child is afraid of being apart from the mom, we may start in therapy by having the mom leave the therapy room and go sit in the waiting room, or go wait out in the hall as a very initial step. And the child that's going to trigger the child's physical feelings, and it's going to trigger the child's thoughts that something bad is going to happen. And what we're doing is we're teaching tolerance, learning how to manage these thoughts and these feelings in their body without running after mom. And we gradually might increase the time that mom is away and farther away. And by the end of treatment, we might have mom drop the child off at the clinic and go shopping and come back. For social anxiety, it might be, talking to the therapist and then giving a little impromptu book report to the therapist or oral report. And then we might bring in a couple of other people from the clinic, and the child would give an oral report to more people, and gradually working up. And the kids learn how to be able to work through their anxious feelings and their negative thoughts, and they succeed. They're able to do these things, and that reinforces them and says, maybe this isn't so dangerous after all. And we provide other types of strategies, as I said, mindfulness or breathing techniques. For the physical symptoms, we can teach them how to reconsider their thoughts. What's the evidence that this bad thing is going to happen? But it really is all about this exposure therapy. And then we work with parents to help reduce the accommodation, and we teach the parents the same techniques. When you feel the need to run in and rescue your child, when you're saying, I'm a horrible parent, I'm letting my child cry, here are the same techniques that you can do, because that's actually an exposure for the parents. The parents are facing their own anxiety without giving into the anxiety, and learning that I can manage these negative feelings, and learning that nothing bad is going to happen. In fact, something good is going to happen by me not intervening. So that's cognitive behavior therapy. That really is it's been quite effective. It's the first line treatment, really. And then medications, are kind of a co-first line. We always start with CBT, because the therapy has we're teaching kids lifelong skills. And after they end treatment, these gains really do last. With medication, oftentimes, once you stop the medication, the symptoms can come back. Not always, but they can. So medication can be helpful as well. We oftentimes will combine medication plus therapy. The research shows that the best outcomes for the average child is a combination of medication and therapy. But we like to start with the therapy first, and if we can get a good outcome, then we don't need to add the medication.
This is an amazing explanation. And I have a really important question as we're getting towards the end. And I want to make sure I cover everybody's questions.
Yeah.
And that is, do you see OCD as a separate and additional issue or a condition, or as an anxiety outlet and way of controlling the generalized anxiety?
Yeah, well, that's a great question. So OCD, it used to be an anxiety disorder in the DSM, which is the manual we use to make diagnoses, and now it's in a separate condition. OCD is certainly, in most cases, it's very much related to anxiety. I'm afraid that something bad is going to happen. I touch something and I feel like I have germs on me, and now I'm terrified I'm going to get sick and die. That's anxiety. But OCD also comes in other flavors. Excuse me, some kids, it can be more of a just right feeling. I need things organized or lined up in a certain way. All my books need to be lined up. All my clothes need to be in the closet based on color or length of sleeve. We have kids that do repeating rituals, touching or tapping rituals, arranging rituals. And some of these are related to anxiety. Sometimes it's just, I just get this feeling that things need to be just right. There's also disgust. Some kids don't like getting contaminated or dirty, not because they're afraid of getting sick. They just think it's gross or disgusting. And that really is, this revulsion really drives them. So OCD is more than just anxiety, but it's very similar. And the treatment is actually quite similar as well. It's exposure-based cognitive behavior therapy. So a child with contamination fears, we might start by just contaminating, putting a little drop of something, or making them touch something just like this for a second to trigger this fear that now I'm contaminated or it's really gross. And we sit with them, and we do this, in a very supportive way. We start very easy, and they learn that, oh, I hate this, I can't do this, it's gross, or I'm anxious, I'm afraid. And over time, sitting with them, they learn that, well, maybe I'm feeling better now, nothing bad happened. I guess maybe this is my OCD talking. Just like anxiety, it's kind of like my OCD false alarm, just like my anxiety false alarm. And then we gradually work our way through these exposures to various symptoms. The kids learn how to manage their symptoms. And these are really, really, we see when it works, and it works for most kids, we see these kids coming out stronger than ever. I faced all my fears and I overcame them, and now I can manage these situations. You have no idea about what a sense of self-efficacy this can really yield to kids that are housebound or can't go to school, and now they're back with friends and they're doing things. And as they start seeing these gains, it becomes so reinforcing for them to be able to go over these, to deal with these situations. And we teach the parents the same thing. Don't intervene, don't give in, support the child. You know, if the child is afraid of that their clothes are dirty or wrinkled or don't look just right, do not wash them. This is part of their exposure. And it really frees up the parents from having to constantly worry and get involved in their kids' symptoms and trying to do things for them. And the parents get happier too.
Well, it sounds like it's just retraining the brain. At the very end,
Exactly.
it comes back to retraining the brain.
It all boils down to that voice in your head says, this is bad. And you say, I don't know, let's check and see. I'm not sure. Actually, I don't think it is bad. Go back, little voice, go back to where you came from. I have a life to live. I have things to do and I want to do that. That's the 5-second explanation of what we want these kids to be doing.
Okay, last question is, at what point is it beneficial for parents to say to friends or school or teachers, my child is suffering from or has anxiety or whatever OCD right now? Is that a good thing or a bad thing? Or obviously it's dependent.
It depends on whether the OCD or anxiety is impacting that situation. For the kid that's not going to school, or the kid that is acting odd in school or doing or avoiding things in school, better that the parents know that it's probably good to let the parents tell the school what's going on, because the school is an important part of the treatment as well. So if the child has contamination fears, and every time the kid next to them reaches over to whisper something, they feel they're contaminated and run to the bathroom, the teacher needs to also do the exposure therapy as well. And if the child, we've had teachers that have said very, very proudly, and in their minds, it's the right thing, I never call on your child because I know they're anxious. Well, that is accommodation, and that's real. And the teachers are just trying to do the right thing. You gotta love them for being so sensitive, but actually the accommodation is the wrong thing to do. So we want to let them know, and they can be part of treatment. And same with relatives or parents of friends. Some older kids, they let their friends know too about it, if it's impacting these relationships or these environments, because we want those people to be part of treatment, or at least understand why the child is acting the way they're acting.
And for the parents that are concerned about giving away the secret that my child is suffering from anxiety, it feels like you could go to the teachers and say, I wanted to see if you can work with me, or have you noticed my child doesn't like to be called on or prefers to be called on? How can we help this? And I found that the teachers actually join this party and want to be an advocate for your child, as opposed to, I'm not going to call on your child, which they don't realize is actually making it worse.
Right. The teachers know something's wrong, typically. Anxiety is probably 10% of kids have clinical anxiety sufficient to disrupt their lives. OCD is probably 1 to 2%. Everybody knows what OCD is. You can't turn on TV, radio, read a book or magazine without hearing references to OCD. I mean, the headlines, anxiety epidemic, anxiety this, anxiety that. Everybody knows what OCD and anxiety are. And we try to normalize it. It's a part of the human condition. It's no different than anything else. And I tell parents when they come in, why does my child have this? Everybody has something. Some kids have a hard time paying attention, which is ADHD. Some kids have a hard time, with their lungs. That's asthma. Some kids are short. Some kids are tall. Some kids wear glasses. Some kids wear braces. Some kids have anxiety. Some kids have OCD. That's just the nature of life. Your child just happens to have OCD. No better or no worse than any other child that has anything else. These are not, it's not the old days when people say, oh, you're possessed, or it comes from bad parenting, or not doing enough of this or enough of that. These are basically biological conditions. They're inherited. They are part of us. They're part of the human condition. And we treat it as such. We're no different than any other doctor that kids come in for. If they break their arm, they need a cast. You know, if they have OCD, they need exposure therapy.
I feel like we can talk about this and there's so much more, but I think the most important thing that I heard you say the entire time was just get your child to acknowledge and then feel through without really opening the wound, right? Without trying to fix it,
Yeah,
and then helping them continue to do the very thing that they're worried about doing.
exactly. Celebrate your child's strengths. You know, and the other thing that people always say is catch your child being good. As parents, we catch our kids being anxious, we catch our kids being bad, we don't catch our kids being good, or we don't catch our kids just being kids. And that's really what we need to spend more time doing.
Allowing them to be kids and
Allowing
enjoying
them
them.
to be kids. Childhood is messy. Adulthood is messy, right? We have to develop tolerance for that.
Well, I can't thank you enough for all this information. I feel like we could have talked for another couple hours, but we are 3 minutes away. So I'm going to say thank you to everybody for staying with us. And I hope that we answered all your questions. Please feel free to email Chip. I'm going to let Georgia tell us how to get there. And thank you, Dr. Piacentini. I really appreciate it.
This was really great. I love talking about this stuff, as you probably can tell. Thank you for the invitation.
Well, thank you. And Georgia,
Yeah,
back to you.
thank you so much, Dana and Dr. Piacentini, for that really informative presentation. And thank you all for joining us today and sharing your questions. This concludes our webinar for supporting your child with OCD and anxiety. We will be sending out the recording of this over email to everyone who registered, so keep an eye out for that in your inbox. And you can also please feel free to contact us with any questions. You can follow Chip on social media. We have a Facebook, a Twitter, an Instagram, and a YouTube channel that also has our past webinars if you're interested in learning more about those. You can also check out our website by visiting mychip.org. I also put that in the chat, so you can copy and paste that link. And just thank you again, Dr. Piacentini and Dana, for taking the time to talk with us today and teaching us so much.
Can I say one more thing real quickly? I just saw a comment about pulling eyebrows or pulling hair and skin picking, which are related to OCD. Those are called body focused repetitive behaviors. Go to bfrb.org. And that's an amazing website, and you'll learn everything you need to know about those symptoms.
Oh, thank you so much.
Yeah, thank you for the last comment. Bye, everyone. Have a great day.
Thank you, everybody. Thank you.